Okay, so this is the equipment section for the on-the-gutter splint. You'll of course need water. Tepid is the best. Do not use hot water with plaster. Some gloves. Plaster of the size for your patient fitting, 4 to 3 inch depending on the size. Cotton, same, 2, 3, 4 inch depending on the patient's size. Stockinette is optional, but use it if you have it. Ace wrap, some scissors, and you could use slabs if you have it. That's it. Okay, so this is going to be the padding section for the on-the-gutter splint. We've done many splints already if you've watched any of the videos. So some of this is going to be, of course, repetitive. You can use stockinette like I'm doing in the video, or you can go straight to cotton. Stockinette is a luxury, and it's great if you have it in a clinic setting, but if you don't, you can do cotton. You also are going to need to buddy tape the fingers, but if you do use the stockinette, you can cut here at the CMC and the PIP on that second finger, and then you can snug it all through. Don't do these cuts individually, as it will not fold your stockinette down well, so do them together. Also, as I said, you could buddy tape the fingers prior to even starting this, which then you don't have to open up the stockinette like I'm doing to buddy tape them. Make sure you wick. I'm doing cotton wicking. You can do 2x2 wicking, 4x4 wicking. Some type of gauze needs to go between the fingers to leave some space for some air to flow. Taping, as far as the buddy tape, you want to tape not on knuckles, so the first tape goes between the PIP joint and the DIP joint on the 4th and 5th. The second tape, and mind you might have to angle it depending on the finger size discrepancy, will go between the MCP and the PIP. So make sure it's not too tight where it's cutting off circulation, but it's snug around the fingers. If they have a tape allergy or something else, or the doctor's preference or provider's preference doesn't allow you to tape, then secure it in place the best you can with cotton. After you finish, of course, pull the stocking back up if you're using stockinette, and get ready to put stockinette on the thumb and the first and second finger. I do the half cut, and I've done this in pretty much all the other splints I've demonstrated on here, and I double over the stockinette so it gives extra padding. I know that area doesn't have any plaster, and why I do that? Well, because normally after splinting you train into casting, so it's a good practice to get you ready for casting if you are going to do it, and it's aesthetically nicer. The second one we're going to put on is for the radial fingers that are open. If your patient's asking you at this point, or the person you're putting it on is asking you at this point of why you're covering all my fingers, tell them that most of their fingers will be free. We are only immobilizing the 4th and 5th with the on-the-gutter splint. So you make 2 cuts on this rather than 1, and you pull it down over. If one cut is not deep enough, like the inside wasn't deep enough, feel free to take your scissors, like I'm doing in the video, cut a little deeper, and it will line up nicely into the middle. Now, as far as starting the cotton portion, if you did use the stockinette, or say you didn't, you can start cotton at the wrist, like that, or you can start cotton at the tips of the fingers. Remember, with an on-the-gutter, unless otherwise told, you want to pass the tips of the fingers so they can't bump them. We are trying to prevent the MCPs from being interacted with, so if the phalangeals are open at the top and they can bump it on stuff, then of course it's going to move the MCPs because they're connected. But starting there, you move your way down. This cotton will try to wrinkle even if you rip through properly. Try to fold that down so you don't get any big lumps of cotton. I still come through the palm twice. I know there's not going to be plaster in the palm because this is a splint and it's only going down the ulnar side. But feel free to rip through and do a couple layers through there, and then it's 50-50 down the rest of the way. You can add a little bit extra if the ulnar styloid looks pretty prominent. Just fan fold onto the ulnar styloid a little bit, or you can use a foam pad on it. Once you get down, make sure in a cubital you're going to be 2 fingers, which is about 1 inch. From the cubicle, it's an easy measurement, a quick cheat, and that's normally about what it is. And it will get you enough space where they can flex and extend the arm easy. The next is ribboning. Again, this is more for casting. You don't need this in a splint. I like to do it. I'm very used to doing it, but this helps more with casting than it does with the splint. And just ribbon inside between the 2nd and the 3rd, and then between the 1st And that's it for padding. Make sure you have them in the intrinsic position or intrinsic plus. That's it. All right, we're moving into the plaster phase of this on the gutter splint. This is the bread and butter of the splint. This is where you're actually putting on the supportive structure. The video is going to go over how to do it in 2 slabs. There's also a 1 slab approach that I will eventually demonstrate. It's usually more common to just put 1 big slab on, but that doesn't mean it's more functional. It's easier to get the 4th and 5th included if you do 2 slabs. Most people, if they do 1 slab, will tend to miss one side or not have enough width, and then you miss the 4th MCP knuckle on either the anterior or dorsal side, and you don't want to do that. You want to make sure those MCPs are included. But for this video, it's 2 slabs. I'm using 3" for the width, and I'm measuring it out on the anterior and posterior section, or dorsal if you want to call it, the back and the front, because that's how I'm going to run the splint for these 2 slabs. Normally the dorsal one will be a little bit longer and the anterior one will be a little bit shorter. So once you fan fold it out, because you want 10 to 15 layers of thickness if you're using plaster, of course 5 to 10 layers of fiberglass is more than enough if you were doing this splint with fiberglass or orthoglass. Once you've got it all rolled out, you of course will dip it, and the water should still be tepid. Your patient, like my demo patient, might mess with the padding. Again, that ribbon on the first or the thumb area was not necessary, but it's a good habit to have, especially if you're in a clinic setting where you do casting too. Ribboning that area where the fiberglass comes through for casting is good. But I'm starting with the dorsal slab part, and I'm making sure that it goes over that 4th knuckle, not just the 5th, but the 4th. So I'm making sure that laminates over, already laminated, already wrung the water out, and then I'm anchoring this on. So 1 anchor at the bottom, 1 anchor at the top, just to hold on this dorsal part of the splint. And I definitely know I have the ulnar side completely in, so the 2 fingers that normally come with an on the gutter are in. This isn't the only type of on the gutter, because technically you could take that next digit in, so you could have the 4th, 5th, and 3rd digit. But this one's just a 2 finger. So next we're going down. This time it's the anterior. Make sure you've laminated it good, and now we're going to anchor the entire thing on. Gravity does not help you hold the interior slab, so it is a little bit harder. Remember, when you're anchoring it on, you only need 1 layer. It's not 50-50, just cover up your plaster is the main goal. Make sure those don't overlap, but they do overlap on that outside, so not on the inside. So where the 4th goes to the 3rd, you don't want overlappage because it's a splint, it's not a cast. But the rest of it you can, of course the outside can overlap. You're always trying to maintain that intrinsic or flexed down position at least a 70 degree, if not all the way to 90. And then as you see, I'm tacking on all the plaster because I want to hold it down. The cotton can be a little bit pulled here to help hold down. It will not cut circulation off. And that's it for that. Okay, so this is the final section for the on the gutter splint. We're going to be folding and finishing up with the ace wrap. The folding, I'm starting on the thumb. There is no correct spot. If you have the stocking at the start, you could start at the bottom, you could start on the finger, wherever you would like to start. It's not really an issue. I am measuring, making sure I got the length. I got the 2 finger arbitrary measurement for about 1 inch. It's to make sure that they have enough room to bend that elbow, because you don't want to restrict motion to the joint that's not really involved. Next, I'm folding the fingers. The reason you want to fold back on the fingers is so you can check cap refill. It should not be able to bump it, but you can definitely touch in there to check cap refill and make sure the fingers aren't black, purple, or losing circulation. Next, you'll make cuts on your radial stockinette, 1 in the inside, 1 on the out. This helps you fold it over the ulnar part and fold it over the thumb. It really helps aesthetically pulling down the cotton on that radial side, so there's no cotton hanging out. Next, flatten out. Don't let any supination, pronation, or rotation happen in the fingers. Flatten it out. You could wait till the end to do this. Plaster does have a long cure/dry time, so you have a lot of play with plaster. Next, I'm going to start ace wrap again. I started at the fingers, You are more than welcome to start the wrist, go up and then down. That is fine. Just do not start at the bottom because you want to move distal to proximal. I did do a cut to help lay it down well around that fourth and fifth to the second and third. Next, I went through the thumb with another cut, and this really gives an aesthetic, nice framework. If you think the patient's going to be rambunctious, you can also tape some of this down. The ace wrap should be wrapped firmly, but not to cut circulation off. And once you finish the ace wrapping, leaving just a slight white edge, you want to hold till dried in the intrinsic position for this on the gutter splint mound. You do whatever your providers are asking of you. Not all will be intrinsic. Tendon ruptures, other kinds of injuries might be in a full extension. So please be mindful of what you're treating. And that's it.